We are online. So welcome, Michael. How you doing today?
I'm doing well, Sam. How about yourself?
Doing great. It's great to have you on. And I know that right now, and everybody's getting ready for the holidays here in the United States, and so it's I'm personally looking forward to Thanksgiving, and I know that our Canadian friends have already had their Thanksgiving, so and they celebrated that, and but I think this overall this time of year is just a great time for us to reflect on all that's happened throughout the year and getting ready for the new year. So
I think so too. And so Sumit and I are out of the country, right, Sumit? So, and I expect you, Sumit, don't have a Thanksgiving holiday, right?
That's right. Although it's interesting, the influence of American holidays, we do have local Black Friday sales, which technically have no meaning because obviously there is no shopping going on for Thanksgiving.
Isn't that funny?
We do have Black Friday and Cyber Monday.
Well, I would just say here, I have a good friend coming into Puerto Vallarta because everybody knows I live here part-time. And my girlfriend's coming here and she does not want to celebrate the typical Thanksgiving. So she does not want the turkey. She does not want the dressing. She wants the fish tacos on the beach. And she does not want no traditional anything. And she's from Colorado, which is where I'm from too. So our Thanksgiving is going to be that. But I definitely miss the time of my dad and my dad's beautiful bride and my family. But I'll get back for Christmas. But yeah, I definitely don't miss the day of cooking those turkeys, though. I mean, the turkeys and all of the sides. I'm sorry, guys. I'm not being sexist here, but why is it? It seems like typically the females are cooking all the turkey stuff.
Well, I know our good friend Howard Niswitz is doing. He's expecting like 20 people over at his house, and so he is doing a great deal of cooking himself. So,
well, good for Howard.
Yeah, that's right.
Wow, I'm impressed.
So tell me, Sumit, is there a holiday of reflection and thankfulness in India that comes to mind?
Not quite, but a lot of urban folks they've actually started observing Thanksgiving, minus the turkey and the American traditions. So, for example, a really good friend of mine and we're going to be meeting after nearly 7 months because she said I make it a point to spend Thanksgiving with somebody I'm grateful to have around. So tomorrow is your turn. So we do things like that. But
that sounds like what we call the Friendsgiving thing. They call it Friendsgiving around here or in the United States. That's really nice.
Interesting.
But I think here in Mexico, they just celebrated independence, Mexican independence. So I'll have to learn a little bit more about that holiday, but that just happened here.
Yeah, all the wonderful holidays around the world, which is nice. All right, well, we're going to be getting started here in about 1 minute as we just waiting for the top of the hour so we can kick things off, and excited about that. So unfortunately, we won't have Jules with us today. She is unavailable. So hopefully we'll do well without her. We'll do the best we can.
Yeah, we can act like actresses and do the Jules thing.
All right, so I'm going to go ahead and share my screen.
Jules usually does the original hosting, but
yes. In just one moment here. All right, I'm going to go ahead and share my screen and we'll get started. All right, just one moment here. So I struggle with my technology.
Well, it's because you're all over the place, Sam. You're everywhere.
Yeah, I'm used to having my own little screen up and so forth, and my home computer. But anyway, let's go ahead and get started with the broadcast today. So welcome everyone to the People Strategies Forum. We're a mastermind dedicated to create those workplaces where people thrive and employees reward and customers love. And so that's what we are focused on as far as our conversations and how to make our workplaces better, more exciting for our people to work at, and that can drive engagement and so forth. And so a little bit about the forum is that we are here on the Zoom platform, and we're, if you're joining us on Zoom, you can go ahead and ask questions and leave those in the chat. We're also multicasting across several different other social media elements, such as LinkedIn and Facebook and YouTube and Twitter. And so if you're catching us on one of those channels, please feel free to leave a message, and if you have any questions, leave a message in that particular medium, and we can come by and capture those after the broadcast. But if you're on the Zoom platform, we can take those questions as we go. So feel free to drop those in the chat. All right, so a little bit about our hosts today. We have Shar Miller. And Shar is one of our longtime hosts here on the People Strategy Forum. She is the one of the owners of Rocky Mountain Health Advocates. She is a talent management and people strategist expert with many years of experience in HR and so forth. And we're very lucky to have here on the forum. Also,
I just so excited to continue with this, and it's been quite the journey. And as a business owner and a former corporate HR executive, I have kind of a unique perspective of actually really running a business in these areas. So thanks, Sam, for keeping me involved.
Yeah, and which is going to be a very important perspective today, as we talk to Michael Patton about selecting benefits and so forth for your employees.
Right.
But also I'd like to introduce you to Sumit Singla. Sumit is our another host here on the People Strategy Forum. Sumit brings us the international perspective on looking at HR operations and talent strategy across the globe. And so he's going to bring a very unique perspective here as far as we discuss about benefit plans, and if you have employees in the US or whether they may be part of your organization and you have an arm in the US where you need to have employees, or if you are starting a small business in the United States, and how to provide benefits is a critical need, of course, in the employee value proposition. So that brings us to our special guest today, Michael Patton. And Michael Patton is the CEO of Palomar Consulting, and it's an insurance brokerage firm that helps clients across the nation of the United States understand their benefits and how they can leverage them most appropriately. One of the most things that we see today, especially in the United States, is benefit costs have been increasing at an escalating rate for years and years now. And some of our international listeners may not have awareness on how these benefit costs are increasing in the U.S. But if you are trying to provide employee benefits here, that's something that's very important for you to understand. So we're going to be talking about that environment, and Michael is going to be speaking on how to best leverage and deliver better benefits for our employees here in the States. Great. Well, Michael, to that point, can you tell us a little bit about how you got involved in the industry, and what was your journey, and how did you get involved in benefits overall?
Thanks, Sam, and the rest of the guys on the comp team, and it's a pleasure to be here. But I do have kind of a unique story that got me into the employee benefits space. I'm an ex-Division I college football coach originally. I'm from Denver, Colorado, and my goal as a kid was to be the head coach of the Denver Broncos. And I was a graduate assistant coach at Colorado State University in Fort Collins. So I coached there between 2006 and 2010, coaching a number of different positions there. And then I was the defensive backs coach at Colorado School of Mines. And that led me to working at my mom's provider's offices. As things happen in football coaching, you frequently lose your job because teams don't win, or the person who hired you, in my case, left. and they bring in new staff, and that's typically how it goes. So I was working at my mom's primary care office here in South Denver, and learned a lot about how the healthcare system works and functions while at that office. And while I was there, there was a pacemaker that was put in for one of our clients.
Wow.
And that pacemaker cost almost $600,000 was
Gee.
paid by the health insurance plan. And there's a reason for that in the American healthcare system. There was complications. The pacemaker started to fall off. They had to go in and do a second procedure in order to reattach the pacemaker. And upon that second procedure, the member caught sepsis and was inpatient for a couple weeks.
Oh,
And that resulted in really high charges being billed back to the benefits plan. Probably nearly $1 million was billed to the plan. It got discounted to just under 600,000. And that was really the experience that pushed me into the health insurance space and the healthcare space, because I was just so surprised and shocked that healthcare could be so expensive. I actually called some family friends who work in the healthcare system in Sweden and Switzerland, and learned that at that time, that procedure would cost somewhere between $15,000 and $20,000. And if a similar error was made in those countries, nothing would be billed, because they were like, well, that would be our fault. So why would we charge you for something that would have been our error? And so that was kind of the wake up that got me into the industry. I chose to get into employee benefits consulting because I thought I could view the movement of money quicker than I could working for a carrier or a hospital. And I think I was correct in that. And I started engaging in the strategies that I currently engage in on the regular in about 2016, starting 2014 and what I mean by that is, we frequently use self-insured health plans or partially self-insured. And for our clients out there, you can do that in a manner, even if you're a very small employer, as small as 10 or 15 employees, by buying insurance on the back end that has, effectively deductibles on it. That covers your healthcare costs, and you work with independent companies that maybe even rent the carrier networks that you're familiar with, Cigna, Blue Cross, United, et cetera, but they pay your claims for you. And frequently we're able to get a little more creative and a little more flexible with the plans when we do that. And I put my first case with a company like that back in beginning of 2016, was very successful in saving a lot of premium dollars for one of my clients. And then I attempted to go move two more of my groups from Cigna here in Denver over to another chassis, and was told that I was not allowed to do that. Otherwise, I could be terminated from my employment if I decided to do that. And that's where I learned that unfortunately, a lot of the, consultants or benefits brokers in the United States have a conflict of interest where they're being paid very significant bonus programs in order to maintain really very large volume with those four major carriers. So that doesn't allow them to look at other strategies which can typically provide more value. And so after that experience, I decided to heck with dealing with firms like that, and decided to start my own benefits shop. And we've been working with these strategies ever since. And we've since added a business model to the side of what we do, where we both consult directly with clients. Typically, our market area for our direct consulting business is mostly Colorado, Wyoming, Las Vegas, New Mexico, Southern California. But we also work with very large employers nationally, New York, Philadelphia, Las Vegas, Florida, everywhere. And then we also have a wholesale platform that we distribute to other benefits consultants across the country, where they're able to resell these same processes that we do every day into a more packaged platform that looks similar to what the health insurance carriers sell, but also creates the added value of what we're typically doing in our health insurance plans.
Wow, a lot there. So tell me, Michael. I mean, you were just talking about a situation where a company had an employee where they had this outlandish bill of a medical bill come through and impact that employee. So I imagine, what are the risks for an employer as they are providing certain types of insurance packages, and that they may not be aware of. I mean, one could be just a plan that's not delivering much benefit for their employees, right? But then there's other plans that could put them under substantial financial hardship. Is that true?
Yeah, that is absolutely true. So the Affordable Care Act broke the insurance market into basically two marketplaces. There's the small group market and the large group market, which depending on the state, in most states, if you're north of 50 employees, then you get into the large group market. In a few states like Colorado and California, that number is 100. And all the community rating means is that everybody has the same rates on the same plans, designated by age, no matter what. So the rates don't change, which can be good and bad, because the rates don't change at all. The rates tend to be kind of high because insurance companies, as you might guess, like to make sure that they're making money on their plans. And so they tend to miss high. So the rates tend to be kind of expensive. And then if you're in that large group market, then your group is being evaluated on the risk profile of your company specifically. If you're 50 lives all the way and above, then the way that your health plan is priced is due solely to the performance. And what I mean by performance, I mean how expensive those claims are. And obviously a $600,000 claim, especially if you're, say 150 life employer, you're probably only spending, in the vicinity of $1 million to 1.5 million, depending on how many dependents you have on your plan. So obviously, if there's a claim for $600,000, that is one claim that would be taking up, more than a third of your total health insurance expenditure on the calendar year. And that's not even taking into account what percentage of that is, administration costs on that.
Yeah. I imagine that's something for international companies needing to know if they hire some U.S. employees. I mean, what are the specific things that they should consider if they're hiring a U.S.-based employee?
Yeah, so a couple things to note. Obviously, healthcare is very expensive in the United States compared to any other country in the world. If you look at, I believe the next most expensive country in the world is Switzerland, and they spend about 11% of GDP, at least last time I checked, which was probably a year ago is my data, on healthcare costs. In calendar year 2020, the United States spent over $4 trillion on healthcare, which puts us at over 20% of our gross domestic product. So on a relative sense, no matter what country you're in, you should assume that the cost of healthcare and insuring against it is going to be at least double what you're used to. And also, obviously we don't have, we sort of do, but we don't have an overarching government run system here. So you as the employer are responsible for the contributions onto your employees. And then also, you probably, depending on what type of industry you're in, you're likely going to need a benefits package to your employees in order to keep and retain them. For most Americans, somewhere between 150, 180 million get their health coverage through their employer. So it is an expectation of most American employees that you provide that as part of the job. Otherwise, it could make it more difficult for you to keep and retain those employees.
Right. So Sumit, can you tell us, from your perspective, and we were looking at some of your clients that are small companies that, what is their when they think about hiring a person in the United States or expanding in the US, what are their assumptions on US healthcare that may be true and may not be true?
I think overall, Sam, the belief is that the US healthcare system is crazy expensive, and I think that's to a large extent true as well, because I was reading the numbers, and the average healthcare expense per person in the US is about twice the per capita income of an Indian. That's the annual income. And there are things like, which as an American you'd find absurd, like the most expensive doctor consultation here would probably be about $25. And you wouldn't have to wait months for an appointment. You could simply call up the clinic today and say, I'd like an appointment for tomorrow or day after. and things like dental insurance, insurance for eyeglasses, they don't really exist in the Indian context or even in many countries in Asia, because these things are at throwaway prices. So you could buy, let's say, a Gucci or an Armani pair of glasses for 250 odd US dollars with prescription glasses. And similarly, there's a thing like medical tourism. So people from developed nations like various European countries and the US, they actually travel to India because a root canal here would cost you what, about $100 maybe. So when Indian employers are factoring in insurance costs, I think they often neglect the kind of benefits that people are used to in the US. Also, on the reverse side, there are some government mandated benefits which every company here has to provide. So, for example, the government of India mandates that you have to provide 26 weeks of maternity leave, and they're now in the process of extending that to not only children who are born to you, but also adopted children. So I believe that's a significant difference from quite a few countries, including the US. So overall, I think there's a lot of disparity in the way Indian employers understand some of the benefits in the US. Also, the variation by state can be significant. So typically, a lot of people do tend to hire advisors in the US to make sure they're not on the wrong side of the law.
Yeah, very important. And if you're listening in as an international leader, definitely look for an expert in the U.S. market, such as Michael, that knows the market and can guide your company in making the appropriate decisions there, for sure. Now, one thing I'd like to dive in a little bit more as an emerging small business leader and so forth. If you're developing a business, or if you have a established business, you're trying to improve your benefits. I'm thinking, Shar, you've recently gone through that process. Can you tell us a little bit about your journey and how you were evaluating the benefits for your employees and some of the challenges that you experienced?
Well, yeah, I actually have a kind of a unique perspective because I worked in healthcare as an executive HR person for many, many years for a couple of major healthcare systems. And I recall sitting at those tables, Michael, talking about those, even in a major healthcare system where we would have an employee with a very, very high claim, multi-million-dollar claim, particularly with a self-funded company, not to give away any names or information of which the healthcare system, but literally financially, it became a real hardship, even for a major healthcare system with, near 60,000 employees or 160,000 employees. In 2016, I ventured off and started my own company, Rocky Mountain Health Advocates. And a lot of my mission and passion was about health advocacy. We offer many products, but the point is that we really wanted to offer our employees benefits, health benefits, affordable health benefits. So early in our journey, I, a small company, we had between 20 and 30 employees back in 2019, for example. We had gotten to the point where we thought, well, okay, let's look at alternatives in healthcare. Maybe we can't afford the most expensive major health insurance providers. But we started to explore like these health co-ops and various health alternatives so that we could at least as a small employer provide some kind of health coverage that wasn't going to break the bank, with our compensation and total compensation processes. What we learned though is that many people, including the owners, myself, needed a better quality healthcare coverage, particularly when it came to like a catastrophic concern, God forbid one of us gets cancer or something like that. The co-op didn't seem to really cover what we were concerned with. Also, some of our employees, since we hire diversity we have one employee that had a catastrophic car accident many years ago, partially paralyzed, works from a wheelchair. Obviously, he gets various medical coverages from the government. But then we had another employee who was struggling with MS. And by the way, it's all HIPAA protected. She did say that she's happy to be used as kind of an example, but she definitely was an employee we wanted to retain. But since she was a young 20-something with MS, our health benefit was not quite what she needed. So then we went back and forth a couple times with, and I'm not here to sell other major health insurance products, but we've gone back and forth. And since our company is kind of volatile as far as we're a health advocacy company, we do certain kinds of testing for our clients. It's not like we have consistent payments all the time to be able to, one, compensate as regularly as we want, but also give those benefits. And so we have struggled. We have gone back and forth a couple times. I'm sure our brokers are not real happy with us because we've had so much changes in our industry. It's been very, very challenging to afford the best quality insurance or coverage and be able to make sure that it gives us the return on investment for retaining our employees. The last thing I was going to say is, yes, during these last couple of years, we all know with the great, as they call it, the exodus of employees leaving, many employees decided maybe Medicaid and not working and being on unemployment is better for me anyway, right? I mean, not to be political here, but many employees will say, I'd rather just quit and get on the government programs, or maybe get fired and get on government programs, versus work with an employer like us who could provide them fairly competitive pay and fairly decent benefits. So yeah, it's been a real challenge for us. Employee retention, employee engagement, making sure that as a health advocate for our employees that we can take care of their health and benefit and safety. And then to compound that with the most recent epidemic stuff, it has just made it extremely challenging. So Michael, I think that the services that you provide are very fascinating to me. It's like you really need to have someone that's objective and not necessarily out to just sell you just an insurance program. Also that really cares about the employees or the employer's bottom line, but also for employees like us that really care about our people, to be able to take care of our people with their health and well-being. So that was a mouthful, but that's my opinion.
Yeah. So Michael, in listening to Shar and some of the challenges that she's experienced, and as an emerging business and business leader, how would you help a company like that?
Yeah, so we find a lot of employers struggle with that balance, and Shar mentioned, the co-op strategy, which can be effective one, depending on what employers you are. And I just like to throw the reminder out there for any international employers that are listening to this. They're basically non-insurance insurance that can provide full coverage, but aren't subject to the same rules that traditional health insurance plans are. And one thing to note for those employers as well is that if you have more than 50 full-time equivalent employees in the United States, even as a foreign employer, you are required to offer a form of traditional benefits. So just be aware that that's for the employers below that size segment. But what we see is a struggle that companies have had, and it's been a slow creep. So healthcare costs have been rising, and there's been healthcare inflation going on for a long time. I mean, really since the 1980s, this has been a steady increase in healthcare inflation when the hospitals really decided that they could pass along losses and potential losses from Medicare and Medicaid, our public systems, for low-income people and for people north of the age of 65. And they could pass those costs back on to the insurance carriers, and thus back to the employers and employees. And then after the Affordable Care Act was passed in 2008, it created some interesting incentives where it capitated the profit margins of the insurance companies, and that really kind of accelerated the healthcare inflation rate. The healthcare inflation rate since 2008 is over 240%. So it's really accelerated that, because with the capitation of the margins from the insurance companies, they have an incentive to pay more for everything. And obviously the hospitals and the drug companies don't mind being paid extra for procedures versus what they were a decade ago. So that cost shift has effectively been transferred over to the employers, who are also now transferring that cost shift back to their members in the form of increasing deductibles, co-insurance. So members who might have had you might remember maybe you had a $500 deductible on your plan and a $2,000 out-of-pocket max in 2010, and you might now have a plan that has a $5,000 deductible with an $8,500 out-of-pocket limit. And you also might be paying more premium for that. So that's how the costs have kind of shifted over to the employees and the employers. So we've seen that trend for most employers. What we like to do and how we typically are helping employers like that is we build platforms that realign the incentives. So that way the incentive for the member is the same as it is for the health insurance plan. And it correlates between both, the value of healthcare as well as the quality. So my dad got a hip replacement here in South Denver about 2 years ago, and it cost nearly $130,000 for that hip replacement inpatient at the hospital. And just so everyone is aware, almost all, the surgeon is maybe recovering $3,000 of that in payment for providing that procedure. Almost all of the rest is going to the hospital facility itself. So what there's a lot of outpatient ambulatory surgery centers, even in South Denver, with sometimes even the same provider that have higher rate of outcomes, particularly because the rate of infection is much lower at outpatient surgical centers. And, those procedures can be done at those facilities for in the wheelhouse of, $22,000 to $28,000 all in. And the way that we're aligning the incentives is that we offer members, we waive their cost sharing if they're willing to engage with these high value, high quality providers. And we also audit all of the providers on their quality metrics using a couple different platforms that measure them on outcomes and volume and a few other metrics. And we score the providers, and we're really typically only recommending the top 2 highest quality providers at a specific place. And what the great thing is it's just an enhancement to the plan, because it's just an option. If you don't want to take that $0 option to you, which means no cost sharing whatsoever, well, you can simply go do what you normally do now, go see whatever provider you want, and then you'll owe your cost sharing, depending on which plan your employer's picked and you've decided to pick. So that's how we're able to realign incentives, is for things like that, imaging, lab work, and most prescription drugs and injectables. We're able to just really use the economic marketplace and procure whatever it is your providers are recommending you need at what we know is a fair market price, which has just become difficult in health insurance, because when you're paying for something indirectly through your employer's health plan, you're not typically that concerned about what the overall cost is of that price. And when you're not concerned that a CT scan is costing $8,500, the fact of the matter is, like, I know as a health plan architect, we can find that same CT scan with the same machine for $210 in your marketplace. Well, if you're a 50 life employer and you are only spending $500,000 a year on health insurance, if you have 25 $8,000 CT scans, you spent over $100,000 just on scans that you could have spent $10,000 on, and that adds up. And for all the people out there, that's what's causing your 10, 12, 15% increases every year, is that utilization. So if you can, create less utilization on your health plans, then that creates extra value for you to decrease the premiums to your employees and decrease the cost sharing, increase their pay, that type of thing.
Right. Yeah. As we all know, as leaders and employees out there, employees should care about this too, because to the extent that they save their employer money on their plan, more can be going to the employee experience, such as pay and other types of benefits and rewards.
Well, I used to support all the benefits coordinators. I was as an HR business partner and director of HR. And yeah, it was extremely frustrating from a compensation perspective. And Sam, you'd appreciate this, particularly talking about the 2 to 3% increases, particularly during the Affordable Care Act periods and the downturn of 2008. Which dates me here, but just trying to explain what was happening from a compensation perspective, and then literally during open enrollment period to be able to be describing the increase of the benefit cost. Very, very disgruntled, I mean, it just caused an entire ripple effect. And particularly as a healthcare company trying to retain nurses and even employed physicians and medical providers, they were exiting to other healthcare systems because our benefits were way too expensive, as well as the compensation wasn't, obviously aligning to what was in the market. So yeah, that's very fascinating. The other thing I want to mention real fast is my experience, even personally. It's a big struggle when, for example, I've been needing a PET scan for a little while, and I finally got on a very good insurance program, but I couldn't even get in to see a doctor. I mean, weeks and weeks and weeks and weeks. And then finally I came down here to Puerto Vallarta. I never was able to get into a PET scan. But back to Samit's point here, I mean, literally, bam, they call it doctor in a box. I can literally walk down the street. I can get an appointment. I had a little accident with my nose a couple weeks ago. I was immediately taken care of. I had immediate resources, and the bill, although it impacted my deductible, I mean, was far cheaper than whatever I would have in the United States. So it's fascinating. Why is it that it's so expensive in the United States? Why is it so costly for employers to keep their benefits going? And why is there such an inflation, Michael? I'm just curious what your thoughts are about that.
Yeah, that's a great question. I think from the macro level, the inflation is occurring partially because of those incentives. If you look at the stock price of everything in healthcare, I mean, to be blunt, literally my entire investment portfolio is in healthcare, and it's somewhere between tripled and quadrupled since 2014 in the value of those companies. And so they've been very successful because of this system and the way it's set up. So in general, it's very good for the hospitals, the health insurance companies, the benefits consultants, and the pharmaceutical related industry. The rest of us are the ones shouldering the load. So I would say the primary reason for the inflation is because they can. And because it isn't noticeable and not enough people are engaging. The market is right now still not demanding a change in order to make things cost less. And I would say a lot of that is, well, mostly because the employers buy the benefits through, the consultants have a financial interest not to present any solutions that might shift how things work. That's probably the primary reason. But I mean, also, the carriers have a lot of power and influence, and they spend a lot of money on marketing, and people want to buy that brand. They want to buy, the Blue Cross card. They want to buy the Cigna card. And that's what employers think that their employees need. So they, typically are continuing that cycle because of that. There's actually a kind of a famous story, and I'll share this information with Sam so you guys can post it. It's a Forbes article. There's an employer called Rosen Hotels in Orlando, Florida, and they're kind of the most famous model. And what they did in order to decrease their healthcare costs is they did, kind of off of Shar and Sumit's point, they took control of the healthcare delivery of their employees. So they built a system. There's actually a lot of doctors out there right now doing things similar to this. It's known as direct primary care. And that is like capitated primary care. So you spend a fee, maybe somewhere between 60 or $8 to $80 a month, depending on the market. And then that allows you unlimited access to this primary care and covers everything related to it. And that guarantees, next day appointments. It has 30-minute office visits at a minimum to make sure that provider and member relationship, employee relationship is there, so they can really get to know you and take and understand what you've got going on health wise and help you get comfortable and then also act on your healthcare. I mean, that is one big problem with the healthcare delivery mechanism at current, is that, you know, primary care isn't paid very much in the United States. Most of the providers are making 150 to 190 grand, depending on the market. And they typically only see patients for about 7.5 minutes. So it's very difficult for them to do an effective job of treating care. My mom actually retired as a PCP because of this. PCP, primary care provider, because she was so frustrated with her inability to create those relationships with her patients and be able to do things about their healthcare costs, which is probably a lot of why we're over medicated, is because the providers don't have time to do anything other than write a script. So when Rosencare took that in-house, they were able, and then they created a referral strategy where they're doing similar concepts to what we do, where they say, okay, we're going to send you to these high quality, low cost outpatient surgeons. We're going to purchase our drugs internationally where we can buy them at a fraction of the cost. And then we're going to cut a direct agreement with Orlando Health System for a lot lower price than Blue Cross is getting, because we're going to capitate it and only send our members to Orlando Health. They're actually able to reduce their healthcare costs, and they're spending in the vicinity of 1/3 what the average American employer spends on healthcare costs. And their company has no deductible and no cost sharing for the members on their plan. So it can be done. It's just a little bit difficult to break through the norm for employers who are purchasers of healthcare.
Well, okay, I have to just interject here, and I know that Sam already knows this about me, and probably Sumit does too. A big reason why I left the healthcare systems, even though I had a big corporate paying position, and I was laid off a couple times, probably because my mouth was too big, is that I was very frustrated and irritated that we weren't really being proactive for our employees. We weren't being real compassionate, dignity, and respect for our employees. And then we were more concerned about the bottom, you know, the dollar. Also, because I worked with the frontline nurses, the doctors, you know, all those clinicians, yeah, you're absolutely right. Just like your mom, were very frustrated when they saw the waste, the high cost, and when we weren't really being patient advocates. So I absolutely 100% agree and commend what you're doing.
That's great. And so let's talk about some of the things that these employers can do, or some leaders can do out there to improve their services. Now, one of those that I want to dive in just a little bit more, Michael, was you were mentioning the ability to offer choice. And educate the participants on the plan as far as, hey, if you're looking for a knee replacement, or if you have or this particular ailment, then you can come to us for some research, and we can give you some of the best providers for that particular situation. So how is that done? Can you dive into a little bit more detail there, Michael, as far as how that's done?
Yeah, absolutely. So we provide member level information packets upon open enrollment. And we find that that's really, really important, that the members are aware that they have these options up front. Because just like anything else, if you don't know how your health plan is supposed to work, it's very likely you'll be frustrated with it. So we find that upfront education is really important, which is why we're looking for alignment between ourselves and the administrative team of the employer in order to deliver that. And even when we're wholesaling this, we make sure that the consultant and the employer are all on the same page to really ensure that that experience is seamless for the group. So we make sure that the members are aware that they have this, what we call the disappearing deductible option, and they know that there's two ways to access it. You can either call in directly and then talk to a care concierge who has access to our digital platform that has all of the places that you can go and the quality ratings associated with those scores. Or if you simply go see your primary care provider and need that care, there's a prior authorization and a pre-certification that occurs. And that actually triggers an outreach from our plan to notify you that this is happening and you have this option. And we do that, and we ensure that that occurs within 1 day. 1 business day, obviously, but 1 day, so that way you're made aware that you can do that. And then we are going to approve that prior author pre-certification to make sure you can go get the care you need. But you do have the right on this, like I said, as a choice to say, hey, I'm going to pass on this. My neighbor is a surgeon of this kind, so I'm going to go see him, even though he's not a network, and you have the right to do that on the plan. But, if for a lot of employees where, you tear your ACL and you can't afford the $4,000 or $5,000 in out-of-pocket costs you would potentially owe on that surgical procedure, you're going to have the ability to go to a highly rated provider in that system, and it's not going to cost you anything. So that way you can get the care you need. Just like Shar mentioned, the struggle she's had with not being able to get in to go see it, to get a PET scan, and being concerned about the costs associated with it. We alleviate those two concerns for the employees of these companies by saying, hey, if those are concerns of yours, we have the ability for you to go get that care for free.
Yeah. So tell me though, I mean, how are these doctors evaluated? I mean, when we're talking about highly rated doctors, I mean, this is not the old boys club where they're rating themselves, right? So
No.
how does this happen? Tell me.
So our vendors pull over 30, the company that we work with is a company called Perception Health out of Nashville, and they score over 38 billion medical claims per year. So they pull medical claims straight from the clearinghouses on everything from Medicare, Medicaid, and the commercial payers, all three of them, and they aggregate all that data together. So especially for like surgeons, where we're primarily pulling these metric outcomes, the most important things that they measure are volume, because of course providers tend to be much better at things that they do all the time. Obviously, in like orthopedic surgery, being an orthopedic surgeon is an extremely broad scope. Orthopedic surgeons can be doctors who work on hands, backs, feet, knees, shoulders, and the doctors who specialize in those different areas and different procedures may not specialize in something else. I mean, you may have a doctor who is a specialist in ACL reconstructions and meniscus tears, maybe mostly for sports injuries, who might have no or nearly no experience doing microfracture surgeries or knee replacements. And the doctor might be amazing at doing ACLs and meniscuses, but do less than 5 of the other 2 procedures a year. So we're typically not going to recommend providers who are not doing very much of a procedure. We find that to be the most important thing. Then the other thing associated with it is obviously the outcomes, and outcomes are measured in a couple different ways. So that the first way that they're measured is obviously, was the surgery successful? So this database is able to track specific surgeries on specific people, and they are able to see how often specific providers have to redo procedures. Obviously, it's a huge detraction to the provider anytime there's an ACL reconstruction or a knee replacement or something like that, and then a fix of that exact procedure is required in the next few years, and their data extends back over 5 years. So we're able to see if any of those same members had to come back in. So they build that into the scoring index. And then the other major thing for the score is infections. Infections are obviously very dangerous. Sepsis kills a lot of people every calendar year. I mean, you're talking hundreds of thousands of people die from medical infections. So that's the other major thing associated with the outcome is, was there any sepsis or infection related subcharges associated with that primary claim? And that's the secondary major detractor on the scores of the providers. So if the providers are creating outcomes where there's not infections and they're not having to redo things, those are the primary 2 indicators on how good the providers are. And then there's a few other things that are related to the providers, but those are the primary, and then they're given a score on our system between 0 and 1,000. And we're typically trying to guide members to only the providers that are A-rated. But we do have lots of clients in rural areas where sometimes there's not a depth of quality. So we certainly advise the members. We let them know, hey, you might be in XYZ rural town, and the only provider that we have in here has a C- rating. You might want to consider driving to urban area X or Y, and our plans typically compensate the member for their travel expenses. and consider going to a provider with an A rating. But we leave that decision entirely up to the member, and the members are actually free to interview up to 3 of these surgeons, and we'll pick up the office visit on all of them, just to make sure that you're comfortable with your care and that you take ownership of that care that you're getting.
Well, how is this is really interesting, by the way, and I have many examples of how this could be utilized. But what is your opinion about the fact that we have shortage of beds? I mean, you talk about the sepsis, you talk about some of the medical care needed, the fact that a lot of rural areas and mountain areas, for example, in Colorado, and you've got to drive, but there's no beds available. What's your thoughts about that?
Well, I mean, obviously from the surgery side, which is what we're kind of talking about in context, we're mostly guiding people to outpatient ambulatory service surgery centers. So typically they're not having the same issues. I mean, yeah, a lot of the bed related issues are COVID related. The COVID cases take up a lot of hospital beds, and the care varies, and some of them are being extremely conservative about keeping those members hospitalized for a lengthy period of time, which limits the availability of beds. So yeah, I mean, I think that that's a macro problem, which is somewhat beyond the scope of even our ability to do much on the plan side of things. We're more trying to help members be guided away from hospitals for certain types of care and guide the members to the highest quality providers. That's really the aim of our plans. But yeah, I mean, certainly the bed shortage is an issue.
So I've got a question here, Michael, from an international perspective. How does one, let's say we're dealing with a company which is headquartered somewhere in, say, Asia, say India. They've got employees in the US and maybe a couple of other countries. How do you explain to your people that the needs of the audience in different countries is different? So it makes sense for a person in the US to have a plan which could potentially cost pretty much as an Indian employee's salary or a significant chunk of it. And similarly, if you're employing gig workers, what kind of coverage do you provide to them, and how do you justify that? How do you make sure that from an employee experience standpoint or from a communication standpoint, you're able to align all the people together?
Yeah, I think that's a really interesting question. So that, like, most employers, in foreign countries are probably unaware just of how expensive healthcare is. And I think it's just a matter of helping them understand the landscape of healthcare in the United States. And you're right, it does seem ridiculous that healthcare costs as much as the salary of an employee in India. But that's just the reality of where we're at. But there are ways, just like I came up with, to get a lot better value out of those dollars than that much. And you can spend fractionally as much as that. There are ways to do that, and calling consultants like myself is a way to do that. But also it's important to understand, really with any company, domestic or foreign or otherwise, what are the needs of that company, and what are they trying to accomplish by covering their employees? I mean, I have clients who, to be frank, are not super concerned with their employees and are just looking for the lowest bottom cost. I mean, especially in the service, the restaurant industry, most of the employees don't tend to get any benefits at all. So if they're getting benefits at all, both the employees and the employers just see it as, hey, we're giving them something they're not used to getting. Versus, if you're in the technology related field, if you're Shar and you're talking about dealing with medical providers, the marketplace for those providers is extremely competitive. So if you're not putting together a very rich benefits plan, which is enhancing the position, you're going to have trouble to maintain those employees. And, very similarly, we're able to put together packages for employers who are in multiple countries and help them come up with a strategy for their employees in each separate country, because that's going to vary greatly. You may have some countries where there's mostly government provided healthcare, and then countries where that's not the case. And we can help them strategize around working those together.
Understood. Thank you. Another follow-up question which I have is, so just a curious one. Do you see people as companies investing in things like medical tourism, like the cost of a CT scan you mentioned? $8,500, that would essentially cover the cost of a return flight to India, and you could stay in a top-notch hotel for about a week as well.
Yep. Yeah, you know what? I have. So when I first started working on plans of this nature, we attempted to do quite a bit of medical tourism, and to be frank, it was actually extremely difficult to get members of American healthcare plans to travel. For instance, even domestically. So when we first started working on concepts like this, we were working on, instead of guiding people to like this network of like surgical centers around here, there's a very famous example of a surgery center called the Surgery Center of Oklahoma. And they post all their prices on their website and they only go down. And so we built in the plan, hey, you know, you can fly to Oklahoma City, we'll cover all the travel expenses, their prices are very low, all that. I only got one member of my plans in the course of like 3 years to take the offer and go travel to Oklahoma City. What we found is that people are really like, they get anxious around that medical care with the notion of travel. So a lot of times there is a lot of resistance to that medical travel, especially with those great distances. And we found that the members are much more, the employees of the plans are much more willing to drive across town, or if they're from an urban area or rural area, drive to a near urban area in order to go seek that care. They tend to be much more open to that than to the true medical tourism, unfortunately.
Yeah, and I think that has to do with the, you know, the American culture as well. I mean, it comes down to trust and the ability to, in how open your mind is to going to other countries. I know a lot of Europeans and Indians and all across the globe, I mean, are used to traveling to different regions, and it all comes down to the element of trust. I have a good friend who loves the Philippines. I mean, he goes over and vacations in the Philippines every year, and of course he's developed a relationship with the people there in the towns, and now what he does is he schedules all of his healthcare needs when he travels to the Philippines every year. So I think it's just a matter of that familiarity and trust, and then how urgent your needs are, right? Of course. So, but anyway, I know this is a fascinating conversation, and we are at the top of the hour. So I do want to switch over and just acknowledge our sponsor, which of course is the TMA method. I mean, this is a way, this is an assessment you can provide your employees to understand their concerns and their needs and so forth as part of they come onto your company, or as you're just catching up with them. You know, so what are their talents? What do they want out of their work? And this also can evolve into a discussion around the benefits and rewards that they have. So a very powerful assessment you can provide your employees.
Right. And I just want to put in a plug for that. I've actually applied the TMA. Not only am I a consultant in the TMA, but I've applied it to my company. It's all about positive psychology. I've actually gotten rid of all traditional forms of performance management, traditional mindset around performance management in my company. We've applied the TMA in all aspects of hiring, onboarding, training, succession management, career mobility, and even offboarding our employees. And I've had quite a positive reaction. And I think that actually it's helped improve our productivity and helped us improve our profitability as an organization. So it's actually an amazing tool, and it's very different than any other traditional HR person would ever be able to talk to you about.
Yes, and so if you're interested in learning more about that, you know, Shar has the experience of applying that to her business and showing how that is used. And I know, Sumit, you are a person that can help on the international context of using an assessment like this and to better your business. Also, I would like to talk about our guest for next week. We're going to be having John Berg from Infinite Equity. I've worked with John for quite a bit of time now of talking about equity plans and how to provide these types of benefits, especially if you're a private company. You might think that these types of long-term incentive vehicles are out of your reach. Well, John is going to talk to us about how to make this a reality at your company, whether you're public or private or otherwise. And so this is going to be a fascinating conversation. He's a great guy, and I think you'll enjoy it. So join us next week on the People Strategy Forum to hear John Berg speak on equity in private companies. Great. Well, I know we're like I said, we're reaching the top of the hour. If you had any questions, please drop them in the chat. But Michael, as we're waiting for any potential questions to arrive, can you tell us a little bit about more about how people can contact you, learn more about your services, and if they have any questions here?
Yeah, they can definitely visit us at palomarconsultantsplural.com. Also, I'll post, make sure that I have Sam share my contact info and share it on LinkedIn. You can get a hold of me, directly through my email or phone number. Connect with me on LinkedIn. So I'll make sure that Sam has all that information, and feel free to reach out. It's very easy. If you're an employer and wants to see, what value that we can provide for you, typically all we need is a census and a copy of like your current bill and your current plan designs. And we're able to get to work for you and see if there's potential for increasing your value on what you're doing with your, healthcare and employee benefits plans.
Great. Well, thank you so much for sharing your wisdom today. And if anybody's out there listening and on one of the social platforms, please feel free to drop your questions there, and we'll send you right over to Michael. And so once again, Michael, thank you so much for your time today. I really enjoyed the conversation.
Hey guys, thanks for having me.
Thank you, Michael. Pleasure meeting you.
Michael.
All right. Take care, everyone. See you next week on the People Strategy Forum.
Okay. See you.
Bye, everyone.
All right.
Happy Thanksgiving, Americans.
Yep. All right.
All right. Bye.
Bye.